Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Today we will be discussing the theoretical aspects of refractive errors, and it is a very basic topic in ophthalmology as we are concerned with vision. So there is a term which is called emetropia. Emetropia means a state of yes, normal vision, but if we define it, it is a state of refraction when eye sees 6 by 6 when accommodation is relaxed. This last line is very important, when accommodation is relaxed. That is why we check it from 6 meter or from beyond that. The other condition is abnormal, and that is not emetropia, that is ametropia. Now ametropia has got different types like myopia, hypermetropia, and astigmatism. These are the only three refractive errors. So this will be hopefully a short lecture, inshallah. What happens in myopia? This is cornea and this is retina. The rays of light are formed. Sorry. Okay, this is cornea and this is retina. So rays of light the image is being formed in front of the retina. This is myopia. That's it. Now, types of myopia. Number one, it can be because of increased curvature of the cornea, curvature myopia. The cornea is more steep, so it will converge more. It can be axial myopia, axial, because if the axial length of the eye wall is increased, usually it is 23.8 to 9 or 24 millimeter. If it is more than that, then it will be axial myopia. And third is the index myopia. When we learn lens, normal physiology of the lens, then we learned that with the passage of time, the crystalline fibers and the lens becomes opacified, and the refractive index of the lens, which is normally 1.4, it is increased. So it offers more you can say resistance to the incoming rays. So it is because of cataract. So it is called index myopia. Okay. Now myopia is also called nearsightedness.
वो एक होता है अगर वो लेंस रिलैक्स नहीं कर पा रहा, मतलब कर्वेचर अपना चेंज नहीं, उसको क्या कहते हैं? वो इसमें किसमें
कर्वेचर चेंज नहीं कर पा रहा?
प्रेस बायोपिया।
कर्वेचर ज्यादा हो जाए ना
किसका?
लेंस का।
नहीं
प्रेस बायोपिया की बात कर।
cornea curvature is anatomically decreased by birth. What you're talking about, that is something else. That is presbyopia. Presbyopia is another condition we will discuss later. Otherwise you will get confused. So
Just a minute.
myopia is also called nearsightedness because if someone is myopic, for example, so his image is forming in front of the retina. So if I am myopic, there are two possibilities to see this paper clearly. One is that I move this image behind towards the retina, and that is I will bring the paper here, or I I
Wear a lens.
yes, or I will move forward. The thing is the same. We are decreasing the distance. You people have seen with glasses. If you have two or three, uh, -2 or -3, myopia is measured in minus diopter spherical, and hypermetropia in plus diopter. So you people who have myopic glasses, you must have, when you take off the glasses, you have to uh, bring the book closer to the eyes, or you cannot watch television clearly from far. Have you noticed it? Try it. Okay, because of the same this reason. Now, what are the different treatment options? Number one, glasses, concave lens. We will place a concave lens here in front of the cornea in the form of glasses. So the rays of light which are coming in myopia, the rays of light are uh, which are coming, they are diverted. So this is cornea. They are diverted so that when they converge from the cornea and the lens, they form the image on the retina. And how much concave lens we will use, it is calculated by retinoscopy or autorefractometer. The second option is the use of contact lenses. The number of contact lenses is also calculated by spectroscope, but it has formula because contact lens sticks on the cornea, and this distance between the glasses and the cornea is almost 15 millimeter. Getting my point? The back, it is called back vertex distance, the distance between the back of the glasses and the tip of the cornea. It is not present in contact lens, so the number is changed, and there are special formulas which the opticians are supposed to know, and they make accordingly. You will give the number of glasses and you ask them to make the contact lenses, they will make the changes themselves. No need to tell anything. And the third and the latest method
Last.
is the removal of glasses by laser, which has got two different techniques. One, the latest is the femtosecond, femtosecond laser LASIK. Uh, 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 Alhamdulillah, I did my second fellowship in refractive surgery and corneal diseases. In what we do in LASIK, uh, we for example, this is the cornea. We take off the flap with the micro keratome. I will try to share the video also. And at the level of the epithelium, we will take off the epithelium. Okay, and you can say this is the epithelium which we remove. We cut here with a microkeratome on the cornea, and then we take this flap here, and here is the flap. Now this is the stroma. Here we apply the laser according to special formulas. Before doing it, we do special scans, and the laser which is used in refractive surgery is excimer laser. It is derived from excited dimer. It is so precise that if it uh, the basic principle of laser surgery is that the cornea is we cannot change the axial length or whatever the cause of the myopia. The only thing in our hand is to change the uh, curvature of the cornea. In myopic patient, the cornea is more curved. So this is, for example, normal patient. This is myopic patient. What we do with laser, we make it less curved, like this. So uh, after taking off, not this is not torn away. We apply laser shots here, and then we replace this flap over the cornea, and it is a 10 minutes painless procedure, and instantly the patient becomes symptomatic at the most on the second day. This is called femtolastic. The second procedure is PRK. It stands for photorefractive keratectomy. And before the advent of femtoelastic, still we perform PRK, and for the especially for there are some indications, and especially if the patient cannot afford the elastic treatment. Uh, what we do in PRK, we do not make the flap. We scratch the epithelium. It is also a painless procedure by instilling proparacaine, which is a topical anesthetic, and with a special spatula under the microscope, we scratch and take off the epithelium from here. Okay, and now this all area is same like elastic is a stroma. We apply laser spots are examiner laser, and then as we have not flap, we place the bandage contact lens. One contact lens is the one which you people might have used for cosmetics. It is a bit larger, and as the name suggests, it is bandage. So it is as the epithelium is being eroded, it covers the eye for 1 day to decrease the pain and irritability. And the difference between the femtoelastic and PRK, the main difference is that it takes a little longer in recovery, and there is a little bit of pain and irritation. The results are same. The results are same. It is cost effective for our population.
Which one is preferred?
Obviously, the one who would have a lot of money will go for femtoelastic. Obviously, but there is no special indication.
दोनों में कोई फर्क इतना खास नहीं, कोई भी करा सकता
कुछ फर्क है. There are little, for example, in femtoelastic we can uh, correct more uh, uh, number of maybe, for example, with PRK we can correct up to 7 or 8 doctor, minus, and with femtoelastic maybe we can correct up to -12. Okay? And similarly, um, um, uh, there are less chances of dry eyes after femtoelastic as compared to PRK, and there is no other significant difference, not very significant difference.
सर तो डॉक्टर्स ये सजेस्ट क्यों नहीं करते मतलब कहते हैं
It
कि
is
नहीं
a
करो
cosmetic surgery. Now, I am a refractive surgeon by my I perform it routinely, alhamdulillah. But I never uh, advise patient to go for it because it is a cosmetic surgery. If the patient asks that, I always ask the patient that glasses are the best because you do not manipulate with the eye. Contact, in my opinion, contact lenses are the worst because you wear it daily and take off, and there are number of uh, chances when it can your cornea can become infected. So if you are not comfortable with glasses, then it is better to go for refractive surgery instead of contact lenses. If you are comfortable with the glasses, that is fine. But if in any case you have to take off the glasses, females usually take want to take get rid of glasses because of cosmetics, and men usually want to take out now also for cosmetics and for sports like cricketers and footballers or people who are going in army, air force, or where it is difficult to take care of the glasses, then it is advisable. But after all, for normal patient, it is a cosmetic surgery. So ethically, it is not good to ask some patient who has come to you for correction of vision, which can be corrected with uh, a few thousand, a couple of thousand, maybe 1,000, 2,000 glasses, and you give him a prescription of 2 lakh. It is unethical. So yes, you can tell him that there are other options, or the patient if asked, then you can go for it. So this is all about myopia. Thank you.